So today our topic is radial nerve. Suppose this is the trunk of our body and this is the arm humerus, and here continues the forearm that is made up of radius and ulna and our hand. So radial nerve is the largest branch of brachial plexus, and it consists of root value C5 to T1. Radial nerve, it originates in the axilla region, and in the axilla as it originates it supplies two muscles, medial head of triceps and long head of triceps. After that, leaving the axilla, the radial nerve passes to the back of our arm, and here it goes along the spiral groove. In the spiral groove, the nerve is accompanied by artery that is known as profunda brachial artery, and in the spiral groove this nerve supplies the following muscles: medial head of triceps, and lateral head of triceps. And the medial head of triceps, the nerve that supplies the medial head of triceps, it then supplies anconeus. After that, after from the spiral groove, the nerve crosses the intermuscular septum, lateral intermuscular septum, and comes in front of the arm. Now, what is lateral intermuscular septum? Our arm is composed of two sides, anterior and posterior. The line dividing the two compartments is known as intermuscular septum. Now, in the front of the arm, this nerve in front of arm, this nerve supplies extensor carpi radialis longus, brachioradialis, and brachialis muscle. These three muscles are supplied. Now, after coming in the forearm region, this radial nerve divides into two branches. One is known as superficial branch and another known as deep branch. The deep branch is also named as posterior interosseous nerve, and the posterior interosseous nerve now supplies all the muscles of the posterior compartment of the arm, or I can say it supplies the extensor group of muscles. And the superficial branch, it gives sensory supply to the lateral 3.5 of the dorsum of hand. Now this is all about our radial nerve, and now we are going to learn about the injuries of nerve. If injury occurs at the axilla, then all the nerve that are supplying the triceps muscle are gone. Then there will be loss of extension. If then our extensor carpi radialis longus muscle damage, so it will lead to a condition known as wrist drop, and all the nerves, all the muscles supplied by posterior interosseous nerve are damaged, mean finger drop will also occur. Now if damage occurs at spiral groove, then extends, first of all long and medial head, matlab in the axilla the nerve, radial nerve supplies the long and medial head of the triceps, means some of the muscles are, of the triceps are intact, so extension will be there but weak. If damage in the spiral group occurs, then extensor carpi radialis longus again damage, it will lead to wrist drop, and posterior interosseous nerve muscles again damage, it will cause finger drop. Now if damage or injury occurs in the arm before dividing into superficial and deep branch, so EC in the forearm, sorry, ECRL muscle intact, then no wrist drop, but pin muscles are damaged, it will lead to finger drop. Plus, as the superficial branch of this nerve is also damaged, it will give sensory loss over 3.5 of dorsum of hand will be there. And now if the injury occurs especially in the posterior interosseous nerve, then finger drop will be visible, finger drop positive, but as the superficial branch intact, so no sensory loss. As the triceps muscle intact, extension normal, and as extensor carpi radialis longus is there, so no wrist drop. That is all for our radial nerve. Thank you.